What if I told you that one of the most quietly searched concerns among older men isn't about heart health, or arthritis, or even memory loss? It's about penis size. Yes, you heard that right. In the privacy of their search bars, thousands of men over 60 are typing the same question. Can I still increase my size? And here's the shocking part. Most of the advice they find isn't just misleading, it's dangerous. From miracle creams to shady injections and overpriced devices, the internet is flooded with promises that prey on insecurity and deliver nothing but disappointment, or worse, permanent damage. My name is Dr. Jonny, and I'm a board-certified urologist with over 30 years of experience helping men maintain their health, confidence, and quality of life as they age. I've treated thousands of men who've quietly carried the same question, and the same shame, wondering if it's too late to do something about it. I'm here to tell you, it's not too late. In fact, science now confirms that there are safe, non-surgical, and clinically proven methods to enhance length. Methods that work, especially for older men. In this video, I'll walk you through 4 evidence-based approaches that actually work, expose the real dangers behind common scams, and reveal the single most effective technique my patients have used, with no gimmicks, no surgery, and no regrets. But before we dive into the how, we need to talk about the why. Because until you understand the emotional weight behind the question, you'll never fully appreciate the power of the answer. Let's start with the truth no one talks about, but every man feels. Let's start with something that's rarely said out loud, especially by men over 60. The concern about penis size doesn't fade with age. In fact, for many men, it grows heavier. When we're younger, questions about size might come and go with moments of self-doubt. But as men get older, especially into their 60s, 70s, and beyond, those doubts often become quieter but deeper. They don't shout, they whisper, and over time, they can start to shape how a man sees himself. I've spent over 3 decades listening to these concerns, not just in the exam room, but in real, vulnerable conversations with men who've achieved so much in life, yet still carry this quiet weight. And it's not just about inches or comparison. It's about confidence, masculinity, intimacy. For many older men, the body begins to change. Erections aren't what they used to be. Hormone levels drop. And in that mix of physical changes, some men begin to feel like they're losing part of what made them feel like themselves. Here's the truth most won't say out loud. Penis size is deeply tied to identity for many men. It's linked to the way they show up in relationships, how they feel about aging, and even how they see their place in the world. And yet, we don't talk about it. In our culture, especially among older generations, this topic is buried under layers of silence. Men were taught to be tough, to keep quiet, and to never admit insecurity. But that silence becomes a burden. It leads many to suffer in isolation, never knowing that what they're feeling is common, and more importantly, addressable. That's why this conversation matters. Because before we talk about traction devices, clinical studies, or therapy, we have to acknowledge what's really at stake. Not just anatomy, but self-worth, connection, identity. The good news? Once that emotional weight is understood and named, it can start to lift. And in the sections that follow, we're going to explore how. Now that we've addressed the emotional weight many men carry, let's look at what science actually says about size, and why the truth may surprise you. First, here's a fact that puts everything into perspective. Most men who worry about their size are actually well within the normal range. In one of the largest global studies involving over 50,000 men, the average erect penis length was found to be about 5.2 inches or 13.2 centimeters. When flaccid, the average length is around 3.6 inches or 9.1 centimeters. From a medical standpoint, a penis is only considered abnormally small, what's called a micropenis, if it measures less than 2.9 inches, 7.5 centimeters when erect. That's less than 0.2% of the population. So why do so many men still feel inadequate? The answer lies not in anatomy, but in perception. There's a real, diagnosable condition called small penis anxiety, SPA, a specific form of body dysmorphic disorder where a man becomes fixated on the belief that his penis is too small, even when it's well within the normal range. These thoughts can spiral into daily distress, affecting everything from relationships and sexual performance to overall mental health. Men with SPA often compare themselves to unrealistic images, internalize media-driven ideals, and quietly feel like they don't measure up. And the older they get, the harder it becomes to separate those private fears from the actual truth. This is why addressing the emotional and psychological root of the concern is so important before jumping into physical solutions. As a urologist with over 30 years of experience, I've seen countless men spend thousands of dollars chasing inches they didn't need to gain in the first place. What they really needed was someone to help them see clearly, someone to say, "You're not broken, you're not alone, and there's nothing wrong with you." Of course, for men who do want to explore physical improvements, there are science-backed options available, and we'll get into those next. But if you're dealing with constant comparison, self-doubt, or shame, the most powerful shift doesn't start in the body. It starts in the mind. In the next section, we'll explore why therapy, often dismissed or overlooked, might be the most effective, life-changing step a man can take. If you're one of the many men quietly seeking change, but hesitant about going under the knife, you're not alone. The good news is that science has identified non-surgical techniques that not only improve physical outcomes, but often provide something even more powerful: emotional healing and confidence. Let's begin with the method most often overlooked, but perhaps the most transformative: psychological counseling. Healing the mind first. For many men, the real battle isn't below the belt. It's in the mind. Decades of cultural messaging, silent comparison, and internal shame can take a toll. That's why psychological counseling isn't just a first step. It's often the most impactful. In my 30-plus years of practice, I've worked with men in their 60s, 70s, even 80s who had spent decades feeling less than. But something remarkable happens when they finally open up, often for the first time. With the help of a skilled counselor specializing in men's health or sexual wellness, they begin to separate myth from reality and shame from self-worth. Clinical studies back this up. Men who undergo therapy for concerns about size frequently experience lasting satisfaction, not from physical change, but from emotional release. Relationships improve, intimacy deepens, and in many cases, the urge to fix their body fades entirely. As one patient told me after just a few sessions, "It's not that I changed, it's that I stopped believing I was broken." Penile traction devices, the only proven device. For men committed to physical improvement, penile traction therapy is the only scientifically validated method that has shown real, measurable gains in length without surgery. Here's how it works. A traction device applies gentle, consistent tension to the penis over several hours a day. Over time, this triggers cellular proliferation, a process where tissue gradually expands, similar to how braces move teeth. The catch? Takes time. Most men who see results commit to daily use for 3 to 6 months. In clinical trials, average gains ranged from 1 to 2 centimeters, up to 3/4 inch. One of my patients, Harold, a 72-year-old retired engineer, approached it with precision. "I don't expect miracles," he said, "but if this works, I'll give it my best." 6 months later, he returned not only with results, but with a newfound sense of control over his body and pride in the process. This method isn't for everyone, but for men who are disciplined and want a non-invasive, proven solution, it can offer both physical and emotional rewards. Vacuum erection devices. For function, not length. Let's clear up a common misconception: vacuum erection devices, or pumps, don't increase length. But that doesn't mean they're not valuable. VDs work by drawing blood into the penis, helping to create and maintain erections. For men dealing with age-related erectile issues, diabetes, or recovery from prostate surgery, these devices can restore performance and confidence. One patient in his late 60s told me, "It wasn't about getting bigger, it was about feeling like a man again." While VEDs won't stretch tissue like traction devices, they improve penile health and can complement other treatments by maintaining blood flow and preventing tissue atrophy. They're safe, easy to use, and often lead to a renewed sense of readiness and vitality. Each of these techniques offers something different: emotional healing, gradual physical gains, or functional restoration. Used alone or in combination, they give men real, research-backed ways to feel better in their bodies, without ever stepping into an operating room. In the next section, we'll explore why injections and unproven shortcuts are not only ineffective, but can be dangerously misleading. Let's be honest, when it comes to changing size, surgery is often seen as the last resort, but for some men, it's also the first thing they Google. There's a perception that if you're willing to go under the knife, you'll walk out bigger, better, and more confident. The truth is far more complex and far riskier than most realize. Before diving into the details, let's preview what's actually on the table. Suspensory ligament release. The most common procedure, the most talked about surgery is suspensory ligament release. In simple terms, surgeons cut the ligament that anchors the penis to the pubic bone. This allows more of the shaft to hang outside the body, potentially making the flaccid penis appear longer. Sounds promising, right? Here's the catch. Erect length doesn't actually increase. It can impact stability during intercourse. Without diligent post-op stretching or traction therapy, the ligament can reattach, erasing gains, or worse, leading to a shorter appearance over time. In fact, many urologists, including Dr. Jonny and other respected surgeons, don't routinely recommend this operation. Not because it's ineffective in every case, but because the risks often outweigh the reward. Other surgical techniques, girth injections, implants, and more beyond ligament release. There's a growing trend in cosmetic penis enhancement surgeries, often marketed with bold promises and high price tags. These include fat grafting or dermal fillers to increase girth, silicone implants, tissue grafts, experimental methods like stem cell injections. While some men report satisfaction, these techniques come with significant risks. Uneven results or deformity, scarring, infection, or nerve damage, reduced sensation, or erectile function, one of the most troubling issues. Many of these procedures are performed outside of regulated medical systems, often by practitioners with little or no urologic training. And once the damage is done, reversal can be difficult or impossible. So when is surgery worth considering? There are rare, legitimate cases where surgical intervention may be appropriate. Micropenis, medically defined as a stretched length of less than 2.5 standard deviations below the mean, post-traumatic injury or deformity, congenital abnormalities. In these situations, surgery is not about cosmetic enhancement. It's about functionality, comfort, and psychological well-being. And even then, it should only be done by a board-certified urologist with extensive experience in reconstructive surgery. Coming up next, the truth about surgical enhancements. In the next section, we'll go deeper into real-life surgical cases, what worked and what went terribly wrong. We'll also explore why many men who choose surgery still end up seeking therapy afterward, and why size wasn't the real issue after all. Because when it comes to penis surgery, the body might change, but the mind always comes with it. If you've made it this far, you already know this conversation is about much more than inches or measurements. It's about confidence, identity, and reclaiming a sense of self-worth that many men lose quietly as they age. You've now learned the truth about what works and what doesn't. We've looked at the emotional weight many men carry alone, the science that reveals most men are already within normal range, proven non-surgical techniques like therapy, traction devices, and vacuum therapy, and the risky reality behind surgical enhancement options. But here's what matters most. You're not alone and you're not broken. There is no shame in wanting to feel better about yourself. But don't chase shortcuts. Don't fall for empty promises or dangerous procedures. Your body and your sense of self deserve respect, care, and truth. If you're struggling with size anxiety or self-doubt, start with the most powerful tool we have, your mindset. A trained therapist, especially one who understands men's health, can help you reframe your self-perception and build real, lasting confidence. If you're looking for physical change, remember, traction devices are the only medically studied method that's shown consistent, safe results. They take time, but they work, and they restore more than length, they restore control. If function is your concern, vacuum erection devices can support your health and performance, giving you a tangible boost without risking damage. And finally, if you're considering surgery, take your time. Learn the full picture. Speak to a board-certified urologist. Ask questions. Protect your body and your peace of mind. What's next? I'm Dr. Jonny, and my mission is to bring clarity to the topics no one talks about, but everyone wonders. If this video helped you, share it with someone who needs it. Leave a comment if you've got questions or want to hear more. And if you're ready to take the next step, mentally, physically, or emotionally, start with truth. Start with patience. Start with you. You deserve to feel strong, confident, and connected at any age. Thanks for watching, and stay tuned for the next video where we uncover what really happens in penile surgeries and what every man should know before stepping into an operating room.